Hello, my name is Angie Gribble. I am Senior Director of Community Health and Engagement with St. Luke's Health System, and today I will be doing a live demo walkthrough of the new Idaho Oregon Community Health Atlas. You should see on your screen here the homepage of the Atlas. Again, it's called the Idaho Oregon Community Health Atlas. It is a public-facing website with the URL up here available to everyone in our communities. That's https:// Idaho Oregon Community Health Atlas.org. This is the landing page where you will come to when you get to that URL. And I will show some navigation of the website as well as a live demo of how you may search data through the Atlas. This Atlas is a product of the 2023 Collaborative Community Health Needs Assessment process, where St. Luke's Health System partnered with other health agencies across our shared geography in Southwest Idaho to produce a community health needs assessment for a 10-county region. Those other partners that we worked with were the Western Idaho Community Health Collaborative, Southwest District Health, Central District Health, St. Alphonsus, Intermountain Health System, and Salzer, as well as the United Way of the Treasure Valley. So I'm grateful for the partnerships with those entities to not only produce our 2023 Community Health Needs Assessment for the 10-county region in Southwest Idaho, but also to pool our resources and come up with this new online database to share data with our entire community. So now to navigate through the website, again, this is the homepage where you will land. There are a couple places immediately to start searching data on this site. There is a keyword search here at the top where you could type in any keyword to start looking for places or data indicators that you're interested in. Or if you know exactly what you're looking for, there's a quick start feature here where you can put in both the place you are interested in researching, as well as the indicator that you are interested, and quickly view maps and charts. This is the feature that I will share a little bit later in the demo today. Continuing to scroll down the homepage, there's a couple nuggets here just about the Health Atlas in general, how to use the Atlas, and then a Contact Us feature. This Contact Us is a way for you to report any bugs or functionality questions that you might have related to the Atlas, as well as to provide any feedback or content questions related to what you see, and you will get a response to your inquiry. The partners that made this possible, I listed at the beginning of this presentation, are all listed down here below. And again, we are so grateful for that partnership. As you looked on the left-hand side here, there are some other pages available. I will go to this How to Use page next. And there's a couple things here I wanted to highlight. First is a features overview, and this is really kind of a quick start guide or tips and tricks, if you will, on what's available in the Community Health Atlas and how you can access those features. So you can quickly see how you might explore places, build charts, download data, etc., right here in the features overview. The next section is about the data. This shows the sources of the data that are surfacing in this atlas, and you can see that there are several that are feeding into this one source of truth. All of these data sets make up the default data library of the Idaho Oregon Community Health Atlas, so they are at this point the current sources of the information that you will see. What's nice about this atlas is as these data sources update, so will the atlas. So it makes the atlas dynamic and current as opposed to our more static PDF community health needs assessment documents that we have produced historically. So we're excited throughout the next 3 years, which is the life cycle of our community health needs assessment, that we will continue to see updated data in the atlas to pulse check on those high priority needs that we have named, see if we're doing better, see if we're making a difference, or also see if there are other needs popping up within our community. The other thing about this data library is that it's super customizable. So we have the ability to add to this library other data sets that we think would be valuable to surface in the atlas. They may be data sets that are more local to Idaho or more local to our communities. They may be data sets that are relevant to the needs and challenges that our communities are experiencing. And they may be data sets that are more current than what we're seeing here. And so if you have any feedback related to data sets that you would like to see built into this library, you can use that Contact Us feature on the homepage and make that suggestion to see if we can build it into our atlas. The last piece here on the how to use is how to cite the Idaho Oregon Community Health Atlas. We are encouraging all community partners to use this site for their own organizational or personal purposes. They may use it to build their own reports, to create their own community health action plans. They may use it for grant writing. The students may use it for projects that they have within school. We encourage them to do so, and this is a nice quick reference on how you may use the atlas and cite it appropriately for however you are using it. The next page here is a data summary. And so this data summary is actually relative to our community health needs assessments and the qualitative data that we captured through that process. So the data library that I showed on the previous page are all the quantitative data sets that helped to feed our community health needs assessment, as well as many more indicators. This page is specific to the community voice that we captured through the qualitative data component of our community health needs assessment. It's surfacing the themes that we heard through surveys, focus groups, and interviews across our communities that help led to the prioritization of those high needs named in our community health needs assessment. So as you scroll through here, again, you can see a description of what that would look like. The CHNA reports here, again, because this is a product of a CHNA process, Community Health Needs Assessment, we have a quick reference to those reports here on this next page. So here at the top, you can see all of the CHNAs associated with the footprint of the atlas. For St. Luke's Health System, the Greater Treasure Valley CHNA covers our St. Luke's Elmore, Boise Meridian, Nampa, and McCall facilities. And we also have the Magic Valley region for our Twin Falls and Jerome facilities, as well as the Wood River Valley or Blaine County CHNA for St. Luke's Wood River. When you scroll down, you can see a summary of each of those CHNAs, what geographic footprint they covered, as well as the high priority needs that popped up from that assessment process. When we go to places, this is where you can see what coverage area is included in this atlas. So this grayed out region here on the right-hand side is what we call the complete atlas region, meaning the entire footprint that's included in this database. You can see all the various counties that are associated with that region. And there's also specific breakdown regions that some of our partners have identified are important to them to lump together as a region. What's exciting about this is you can see it's a really comprehensive footprint for St. Luke's Health System. It not only covers the counties where we have a CHNA obligation of reporting, but also the surrounding counties where we know we serve patients and have a presence. When we go to the indicators page here, this is the list of all the individual data points that are currently within the atlas from that default data library. You'll see the different categories of indicators here. And when you drill down to each of them, you can see the individual data points that are available under each of those categories. If you were to toggle this Show Details button here, you can get a little bit more information about those indicators. You get a definition of what exactly does that indicator mean, what is the source of that indicator, and what is the time frame for which there is data available for that indicator, which can help you understand how current is this information, and will I be able to see a trend over time, or was it just recently captured as the first data point? Okay, I'm going to go back to the home page now so we can start to do a data demo. Using the quick start feature here, I will type in one of the counties within our footprint and one of the indicators that may be of interest for our health system, as access to care is one of our strategic priorities, as well as a high priority health need from our community health needs assessment. So we'll look at uninsured rate. I will type both of those in and then click View Map. This is where we land when we do that start. You can see there's a map of Ada County, which is my area of interest that I indicated. And what I'm looking at is the uninsured rate. At the top of the screen, it shows a definition of that indicator. So the numbers that I'm seeing represent a percent of residents, and the definition is the percent of residents without health insurance. If I want a little bit more information about that indicator, I can click on this green eye here and get not only the definition, but also the time period for which it is available, the geographic layers for which it is available, the category of indicator that it falls underneath, and more technical documentation about that data source right through here. Not all data points are available at these various geographic layers, but where it is possible and the data has been captured at that layer, it'll be surfaced in the atlas. That is another exciting feature because our community health needs assessments typically just go to information at the county level and don't get as granular as cities and towns, zip codes, or census tracts. So this atlas does allow us to drill a little bit deeper into our communities on some of those needs and data indicators. The map here is a heat map. Right now, you can see on the right-hand side, we're looking at census tracts. So we are as drilled down as possible as we can get within this indicator. You can change that to different layers if you'd like, just by selecting the various options over here on the right-hand side. I'll go back to census tracts though. This heat map applies to a gradient here on the left-hand side that as you scroll over the various percentages of residents, you'll start to see the census tracts pop that apply to those percentages. So as we scroll up and get closer and closer to the dark blue with the 100%, meaning all residents are uninsured, you can see those census tracts of needs start to pop. Another feature that you can do within the map is you can filter, which means you can start to layer different indicators and see co-occurring indicators at the same time. So right now I am on looking at uninsured rate, but if I were to add a filter here, say below 200% poverty level, now when I click on a census tract, it'll show me both of those indicators for that census tract. So for this one in particular, for Ada County, the uninsured rate is about 19.5% of the residents are uninsured, and a little over 25.5% are below 200% poverty level. So that allows you to see co-occurring data points or needs or circumstances for the same population in one graph, which may tell a little bit more to the story of the comprehensive challenges or situations that individuals and families might be experiencing who live in that census tract. You can also, in the map layer, add a pinpoint of a location. So in this case, because we're in Ada County, I'm going to add the address of our downtown hospital, and it is going to drop a pinpoint here to show location of that hospital. What's exciting about this feature is you're able to do some asset mapping and that you can drop pinpoints of resources that may address the need or the data that you are looking at and start to see where those resources are located in reference to areas of most need. For example, imagine you had a map of food insecurity and we're looking at that data point and you were able to drop food banks within your area. You may then see our food banks appropriately located within those census tracts of highest need for food insecurity, and or if not, how might we think about delivering those resources to the right places or delivering them differently for folks who could most benefit from those resources. The next ability in this page is to look at charts. So this is where you can start to see the data in bar charts, line charts, etc. I'm going to start by looking at the full population here, and I'm going to look at a line chart over time. So this is because the indicator has been captured for several years, you can see the trend of this indicator over time, in this case from 2008 all the way to 2021. The region of interest that we have been looking at is Ada County, which is the blue line, and the default comparison region is the complete atlas region, so that full footprint of counties that I showed earlier under the Places tab. You can add other areas for comparison though. So say you wanted to add Elmore County as a neighboring county to Ada, and you also wanted to add the state of Idaho as a whole. you were able to add those to your chart as well. State of Idaho showing up in orange and Elmore County now showing up in green. So you can see some comparisons that way. If you wanted to just look at this at one point in time, so the most recent data that was captured, you can click on the bar chart. And again, I've got all my comparison regions that I had entered on the previous page, but this time it is shown in just a bar graph between the time period of 2017 to 2021. Where the data has also been captured with other demographic layers, you're able to add that into these charts as well through the Change Stratification or Time Period button. When we click on this, right now we're looking at the full population, but if I wanted to stratify the data by race or ethnicity, I can click on that, and now you can start to see what that looks like between my 4 areas of interest right now. This one also was captured by sex, as well as by age. And you can combine a couple of those as well here. So you can, again, start to drill a little bit deeper into segments of our population that may be experiencing this need in a different way compared to the full population or other populations within our community. You may also change the time period here if you have a different time period of interest that you were looking at. The settings down here or options button allows you to do some different things with the graphs as well, the charts as well. You can label the data points if you'd like to label the data points and see the exact numbers. You can include those confidence intervals, show subtitles, etc. So depending on what information you're looking for or for what purposes you're using this information, you may want to toggle on some of those various options. Finally, as I mentioned, we really want our community partners and community members to use this. So there are options that you can change the color scheme even by doing a drill down here. And say you wanted to make it St. Luke's branding scheme, you have the opportunity to change colors of those bar charts before you were to download that or take a capture of it for, say, a PowerPoint presentation or a report. Speaking of that, you have the opportunity to download this data really quickly with the download button here. You can download this chart into images, into a PDF document. You can print the chart right away, or you even, if you wanted to see the raw data behind this chart, can create a CSV file of the data or an Excel file of the raw data behind this chart here quickly through the download feature as well. The rank tab is another way just to show comparison of the need between all of the places available in the complete Atlas region. In this case, it starts with looking at counties and it ranks all of the counties relative to the need you have identified. And the number 1 county, or what's listed first, in this case, Owyhee County, has the highest percentage of residents that, again, in this case, are uninsured. And then it goes all the way through the 20 counties that are included, ranking them so you can see them in a comparison way in a table format. Finally, this Sources tab also provides more information about the source behind this indicator. So again, some of those technical notes, information about, in this case, the American Community Surveys, and any other notes related to the release or data behind it. That is essentially what you can do related to searching data and looking for indicators and trying to explore the places within our footprint. As I mentioned, this site is highly customizable, so we certainly welcome feedback on how this can be a more usable and user-friendly and relevant resource for you, for those of you within St. Luke's Health System, and for all of our community partners and community members. We want folks to use this and point to it as a source of truth for community health data throughout our footprint. If you have any questions or would like future information about the Atlas, feel free to reach out to me. Again, my name is Angie Gribble, Senior Director of Community Health and Engagement for St. Luke's Health System, and I'd be happy to help you with anything else I can. Thank you so much for joining.